I am one of approximately 95,000 family physicians who are located across this country in almost every county. We're in solo and small group practices, and I'm happy to be here to talk to you about H1N1 virus and the economic health of the nation on small businesses, because we are small businesses. I'm a small business. The last patient I saw, because it was mentioned earlier in the southeast, I'm from Tennessee, was a 10-year-old with H1N1 flu before I flew up here. Driving here in the car on the radio, the first death in Memphis is a high school football player who died in the hospital with H1N1 flu. So we're seeing it already, and it is a very important issue. Family physicians are affected with outbreaks of diseases like H1N1 in two very important ways. First, we are the front line for diagnosis and treatment of the disease. Patients who begin to experience H1N1 symptoms often go to their personal physician. Frequently, it's the primary care physician who begins to see the pattern of infection. Once the outbreak is determined, the primary care physician will need to provide health care services to both the infected patient and the worried well, patients who need to be reassured and educated. Secondly, small group practices like myself may be affected significantly ourselves in doing business. A family physician's practice, especially in rural areas and underserved city areas, often consists of only one or two physicians and a small clinical and administrative staff. When one staff member begins to show H1N1 symptoms, it is vital that they stay away from the practice in office so that patients do not become ill. As a result, if the influenza outbreak infects just a few members of a practice, that practice may have to close temporarily. Unfortunately, this is likely to be a considerable length of time. We talked about this one being a little mild, 3 to 5 days, but you wouldn't want a sick person in that office if you were coming in for maybe even longer. Last, an outbreak of H1N1 will expose two major deficiencies in our healthcare system: the lack of coordination and workforce shortages. For example, patients can get vaccinations at multiple sites: retail health clinics, work site clinics, health fairs, pharmacies, school-based clinics. While these sites make immunization convenient, they lead to fragmentation of patient care. Especially, it makes it very difficult for a practice to ensure that all of the patients have received the necessary shots. The Academy, along with other primary care groups, including the American Academy of Pediatrics, have recommended implementing a patient-centered medical home to address the lack of coordinated care. The patient-centered medical home also would connect primary and public health, especially in areas which the medical home and public health functions are more tightly integrated. Second, even before H1N1 becomes a pandemic emergency, family physician practices will pay the price for our nation's shortage of primary care physicians. As the number of infections increase, family physicians in small and solo practices will be overwhelmed by the number of patients simply because there is nowhere else to go. These practices will usually serve rural and inner-city populations, will not have all of the resources to handle a growing number of infected patients. That is why Congress must address education and training of primary care providers in health reform legislation. The Academy has recommended that Congress increase medical graduate education payment for primary care residency slots. This would provide incentives to the nation's teaching hospitals to invest in primary care residencies. Family physicians and the Academy are taking the threat of the H1N1 outbreak very seriously and are engaged in extensive preparation. We see it as a fundamental responsibility to provide patients with the right information at the earliest possible time. However, they and their patients will feel that the brunt of the deficiencies in the nation's fragmented healthcare system. We will need a better investment in primary care to meet these challenges and look to Congress to make this happen. Thank you for the opportunity to testify, and I'll be happy to answer any questions.